My name is Dr. Carlo Hatem. I'm a pulmonologist and intensive care specialist with El Paso Pulmonary Association. So in the past 2 months, we've seen a steady rise in the number of coronavirus cases in El Paso. And we have not, or we do not appear to have reached the peak of coronavirus cases in El Paso. We need to continue to be vigilant. This is in contrast to other parts of the country like New York and New Jersey, where they clearly reached their peak and their cases are coming down. Here in Texas and in California, the cases continue to rise and we need to be vigilant, very vigilant. Another peculiar aspect of El Paso is that there's a significant number of activity and cross-border traffic, and people need to be careful about carrying the virus between communities. The primary thing that we're doing right now with coronavirus work is to provide standard of care, highest standard of care for patients who are sick in the hospital and in the intensive care unit. They are receiving care at the very highest levels. However, in addition to that, there are very few treatment strategies that are proven to be effective with coronavirus. One of them is an antiviral medication called remdesivir, which is rationed by the government at this point. The other one is a promising treatment strategy, which is plasma, convalescent plasma. This is plasma obtained from people who have previously been sick with the virus and have recovered. They have developed antibodies, and those antibodies will help people who are currently sick with the condition. We have done a lot of work in terms of obtaining plasma by recruiting donors, encouraging donors, walking them through the process, and referring them to the local blood center to donate. And on the other side of that, we have used the plasma in a number of patients, and we have seen some promising beneficial effects to the plasma. The plasma donation process takes about 2 hours, more or less. It is entirely done at the local blood bank, Vitalant. The reason it takes so long is that the machine that's used is a special machine that is able to separate the blood from the plasma and keep the plasma and return the blood to the person donating. And that takes a little while. Anybody who wants to be tested for antibodies can get tested for antibodies for the coronavirus. There's a large number of tests available on the market, but not all of them have been verified or proven to be reliable. There's a very limited number that has been approved by the Food and Drug Administration. We do recommend that you use a reputable lab, one of the national labs, CPL, LabCorp, or Quest, and these have a proven track record in reliable testing. If you want to be tested for antibodies, you can either call us or you can contact your physician, and they will provide you with a requisition and the test will be performed. The question of whether an antibody test or the presence of antibodies confer immunity is still not answered at this time. We hope that the presence of antibodies protects against future viral infection, but that has not been confirmed or verified. The whole idea of developing a vaccine is to provoke the body into generating antibodies, and the hope is that these antibodies will be protective. This has yet to be proven with certainty. I think I would like to clarify that the virus is primarily transmitted through the air and not as much through the touching. It's definitely a good idea to continue washing your hands and try to be as clean as possible, but the primary transmission mode is through the air. And wearing a mask is a very good idea in terms of preventing transmission and being infected yourself as well. So wearing a mask is very important, especially at this time. that people are going out with increasing social contact primarily to protect yourself, but also to protect others.